The members of Congress just recently sent a letter to their fellow lawmakers asking them to make children's dental health a priority. So tooth decay is the most common chronic childhood infectious disease in children, more common than childhood obesity, asthma, and diabetes. Research over the past 20 years shows nearly 57% of adolescents 12 to 19 years old have tooth decay in their permanent teeth. Older adolescents, Mexican-American adolescents, and those living in families with lower incomes were more likely to have decay. Our Sally Hernandez talked to the president of the American Academy of Pediatric Dentistry for an in-depth look.
Can a cavity or some kind of infection get in the way of a child's growth when it comes to their teeth?
Yeah, it's not just about cavities and baby teeth. It really affects your entire health, both kind of your physical health and your behavioral health. There's a lot of evidence that shows, cavities and baby teeth certainly affect what happens in your adult teeth, but it affects how well you eat, how well you sleep, how well you do in school. So it really is an important part of your overall health.
So what do we need to do? What do parents need to do to make sure that they don't have this kind of problem when it comes to their kids?
Couple of things. One is make sure you see your pediatric dentist regularly. The other is what you can do at home. And there's two major things there. One is diet. And really, it's all about snacking. You don't want to overdo the sweets, certainly, but really, it's the way I describe it to my parents in our practice is the more times you eat or drink, the more cavities you'll get. Even if it's nutritious food like apples and bread and milk, you should be eating all those things. But if you're constantly nibbling, grazing throughout the day, that's what's going to cause cavities. The second is brushing with the fluoride toothpaste. Brushing in the morning after breakfast, last thing before bed, and no rinsing with water after brushing. That just dilutes out a lot of the fluoride that's critical in preventing cavities.
What age should you start seeing that dentist?
The American Academy of Pediatric Dentistry recommends that all children see a dentist by their first birthday. But I recommend, as soon as those first teeth come in, which is typically around 6 months, there's a lot that we can do during that first visit. It helps children become more comfortable with being a dentist, but we can also talk about how to prevent cavities, but also things like thumb sucking and pacifier habits, what to do about teething, all the issues that concern your child's oral health.
Wonderful. Great information. Thank you so much again.